Okay, it's time to record the demo for the standardized interview. Can you give me the first clinical scenario, please?
Sure, let's start the first student module.
Hi, I'm a medical student. I heard you were having some trouble after you got back from your trip in Costa Rica. Can you tell me what's been happening?
Sure. It started with a tingly feeling in my feet a few days ago, but now my legs feel weak. It's getting harder to walk, and I need help to stand because I feel like I might fall.
Can you help me understand how the story unfolded and what happened in what order?
I got back from Costa Rica about 3 weeks ago. Then, about 2 weeks ago, I had diarrhea that lasted a few days, but it went away on its own.
Have you had any signs of fever? And have any of your joints been red or swollen?
No, I haven't had any fever, and my joints haven't been red or swollen.
Any difficulty going to the bathroom, urination, things in that department?
No, I haven't noticed any problems with that.
Okay, that's good. Why don't we stop there and move on to one of the ethical scenarios?
Great. Let's dive into the first scenario. A patient comes in with severe abdominal pain and insists that they need pain medication immediately. However, based on your assessment, the patient's condition doesn't warrant strong painkillers. Question 1. How would you handle the patient's request for immediate pain medication?
Well, pain meds can be a tricky thing, so I'd want to make sure that I was taking appropriate pain history and not making any assumptions before I asked them a few more questions.
Question 2. What steps would you take to communicate effectively with the patient about their pain management plan?
And let's do a Royal College scenario. Make it a hard gastroenterology case.
Great, let's get started. Here's your first case. A 35-year-old male office worker presents with complaints of fatigue and a slight tanning, or perhaps yellow coloring of his skin. What are your initial thoughts on this presentation? What additional information would you like to gather at this stage?
Oh, that sounds too difficult for me. You'd have to ask a real gastroenterologist, I guess.